If you were lucky enough to attend our previous webinar on vaccines, some of this might be a little review, but we've definitely added some new stuff. So hope that you can learn something, and we will get started. Hopefully a few more people will be joining us. We had a lot of people register, but I don't see nearly that many on. So without any further ado, then let's get started. The former title of this presentation was called Vaccine Confusion, What Does My Pet Really Need? And I kind of like this slide, so I just kept it in here so you guys could see it. Let's start by talking about what is in a vaccine. So a vaccine contains an inactivated or weakened bacteria or virus organism. Sometimes they can contain just a piece of the bacteria or virus because the immune system is capable of responding to certain things that are pieces called antigens. There are various chemicals that are used to inactivate or kill the bacteria and viruses. These include formalin and ethylenediamine. And ethylenediamine is considered to be a skin irritant. It has been used in some commercially available skin products, but it can release toxic and irritating vapors. It's extremely irritating to the eyes, lungs, and the mucous membranes. And exposure to a relatively small amount can seriously damage health and may even result in death. Formalin is a 40% solution of formaldehyde, which is a long-suspected carcinogen or chemical-causing substance. And it's also highly irritating to the mucous membranes. So these really are not substances that you want injected into your pet every 3 years, or even worse, every year. So what else is in a vaccine? Either a modified live, which is a weakened virus vector. Usually in cats, they use a canary pox vector. These are in some of the so-called non-adjuvanted vaccines, the PureVax series. They make a lot of vaccines for cats. They make a PureVax Rabies, PureVax Feline Temper, PureVax Feline Leukemia. I don't believe there are any of these for dogs at this time, mostly because dogs have not had these vaccine-induced or vaccine site tumors. That was a big scare with cats several years ago. Most of these vaccines have only been approved for 1 year duration of immunity because it would cost a lot of money for the pharmaceutical company that makes the vaccines to do the study longer. However, the feline rabies, I understand, has recently been approved for 3-year duration. There also can be adjuvants. These are usually some sort of metallic salt, including things like aluminum hydroxide and aluminum phosphate, as well as various other compounds. And these substances are meant to just cause a local inflammatory response and do what's called non-specific stimulation of the immune system. So that means they're not stimulating the immune system against a certain bacteria or a certain virus. They're just stimulating inflammation. And interestingly, aluminum also stimulates an antibody called IgE, which is the antibody responsible for allergies. Therefore, any vaccine containing an aluminum adjuvant has the potential to cause severe worsening of allergies. Conventional veterinarians are completely unaware of this association and will often continue to vaccinate patients with allergies. There are other substances that may be in a vaccine, things such as thimerosal, which for many, many years was used as a preservative. Thimerosal is about 50% mercury, and its use has declined over the past 15 to 20 years or so, even though the FDA will still say, oh, it doesn't carry any risk. The element mercury is a potential neurotoxin. It seems to affect younger patients far more than mature patients. And thimerosal is more likely to be found in multi-dose vials, which we certainly don't use. We use only thimerosal-free vaccines at Natural Pet. Just a small side note, this is not to be confused with homeopathic mercurius, which actually does not contain any mercury. So if you're interested in finding out more about homeopathy, what it is, what it isn't, check out my webinar on homeopathy. So why do we vaccinate? pretty obvious. We vaccinate to prevent potentially fatal conditions, things such as rabies, canine parvovirus, canine distemper, or feline herpes and feline calicium. We may also vaccinate to control and prevent outbreaks of highly contagious diseases in high-density populations, kennels, doggy daycares, grooming facilities, those types of things. For instance, the Bordetella vaccine, which is the so-called kennel cough vaccine, it usually includes Bordetella and parainfluenza, but kennel cough can actually be caused by about 10 different organisms that just create a cough type condition. Why might we choose not to vaccinate? There are plenty of reasons. If a patient has a history of a disease or condition that is suspected to be made worse or caused by vaccination, a condition called vaccinosis, we definitely don't want to vaccinate them, or we want to minimize their vaccination as much as possible. Vaccinosis can include conditions ranging from itchy skin, recurrent ear infections, behavior problems, to even seizures. So the risk will clearly outweigh the benefit in these types of patients. Some of them may qualify for a letter stating that even the rabies vaccination is too risky for them. For patients with severe immune-mediated disease, any vaccination can result in potentially life-threatening consequences. And suppressing the immune system with steroids and antihistamines, as conventional veterinarians do, is really not ideal, and it can lead to more problems later on, such as increased cancer risk. If a patient has a chronic illness, and/or may have a suppressed immune system, something such as kidney disease, FIV, cancer, the risk definitely outweighs the benefit. And again, in most, if not all of these cases, any disruption, anything that disrupts the balance of the system can have the potential to cause life-threatening consequences. If a patient has a diagnosis or does not have a diagnosis, we don't know what's going on, but we suspect that there's a poor prognosis, why would you vaccinate if there's a chance they might die soon or possibly be euthanized soon? I have seen some clients come in with pets that have been actually diagnosed with chronic illness, ranging from hormonal problems to even cancer, that another veterinarian vaccinated them just because they were due. At the very least, if a patient doesn't have a diagnosis, but we suspect something with a poor prognosis, vaccination should be delayed until more information is available. And the fourth reason is if we believe the patient has an already existing protective level of immunity through something called the titer test, which we'll talk a little bit more about later. But in these cases, vaccination does absolutely nothing for the patient, and it has the potential to create illnesses such as allergies, autoimmune disease, inflammation of vital organs, including the brain and spinal cord, and even predispose the pet to cancer due to some of these adjuvants and chemicals that we talked about earlier. So what is a titer? A titer is a measurement of the level of antibodies in the bloodstream. In some cases, it's a number, and the lab says, oh, above 30 is protective. Usually it's greater than or less than, because they dilute them. Sometimes it's just positive or negative, meaning the antibody was or was not detected. The reality is that the immune system contains memory cells that can quickly spring into action, rapidly creating more antibodies if the offending antigen is encountered. Unfortunately, it's not yet possible to measure these memory cells. It may never be possible because they only come out when they're needed. However, there's a recent study done through Kansas State University investigating rabies in previously vaccinated animals whose vaccines had expired, that absolutely none at all of the exposed patients contracted rabies. And this is an example of memory cells at work. Now, you never see a study that's absolutely like that, so I think that's pretty amazing. Just want to talk a little bit about the American Animal Hospital Association's position statements for vaccines. This is pretty straightforward. So they do acknowledge there's growing professional and public awareness that vaccine products are not as benign as first believed. I think that's a huge step in the right direction, because for far, far too long, our whole profession has been vaccination oriented. Vaccine administration is a medical procedure with which there are benefits as well as attendant risks, and so these risks must be weighed and a medical decision then made. They go on to say that the veterinarian involved should use his or her clinical skills, knowledge, judgment, etc., along with client input to act in the best interest of the patient. I don't think vaccinating a dog with cancer is in the best interest of the patient. They go on to say the vaccination needs of dogs and cats should be assessed at least yearly, and vaccination schedules should be modified on the basis of various different changes in lifestyle and environment. Just a little bit more before we leave the AAHA statements. The last portion that I want to tell you guys about is vaccination should be considered just one component of an individualized, comprehensive preventive health care plan based on all these other things. And I included a picture of this poor haggard old cat because I have certainly seen some veterinarians that'll just poke this cat with vaccines without even determining whether the cat has any type of chronic illness or whether he or she even needs the vaccines. Hopefully that is becoming the way of the past, and that titers are going to start to become the norm. There are some benefits to vaccination. I think they're pretty straightforward, pretty commonly known. They can help decrease incidence of certain diseases, and they have helped to eliminate all but eliminate certain diseases, because I really don't see canine infectious hepatitis. I've been practicing for 16 years, never seen a case. Doesn't mean it's not there, but pretty rare. Vaccines are great, so why not vaccinate all dogs and cats for everything every year? If your veterinarian currently recommends this, you should ask them why. Do not be afraid to ask your veterinarian why he or she recommends something. You have the right to know. A little more about potential side effects of vaccination. Obviously, allergic or immune-mediated reactions. Vaccines have a pretty profound effect on the immune system, especially when given in excess. So you can have immediate reactions. Face swells up, eyes swell up. That's really serious. Sometimes the throat swells up. You can have reactions where blood cells are attacked. That's IMHA, or where the platelets are attacked. That's ITP, and certain breeds seem to be more susceptible to those, including Cocker Spaniels. You can also have vaccine site tumors. This typically occurs in cats sometimes in association with the rabies, the adjuvanted rabies vaccine. That's the whole idea behind that PureVac series, which doesn't have any adjuvants in it, but they can be very nasty tumors. There's also something called vaccine-induced immunosuppression that happens every time a patient gets the very first modified live vaccine. And it begins 3 days after the vaccination and lasts for somewhere between 7 to 10 days. If the patient is being spayed or neutered at the time, there are other things going on that are stressful at that time, they're going to a new home, the result may be inadequate immunity to the vaccine or illness from other causes. Upper respiratory infections in cats, sometimes in dogs, parasites. So it is so important to minimize stress from any young patient that has recently been vaccinated for at least a week to 10 days. So hypothyroidism has become an epidemic in both humans and canines. There is plenty of research, mostly done by a woman named Dr. Jean Dodds, that has proven that antibodies against thyroid tissue are associated with vaccination with the rabies vaccine, and sometimes with combination, but it seems like rabies seems to be the one most often implicated. And vaccination against diseases for which there is little risk of exposure may actually do more harm than good. Things like leptospirosis in little bitty dogs that don't really go outside very much. I want to take a few minutes to talk about vaccinosis. It may or may not be a term that you've heard before, but it's definitely something that I'm hoping people will become more aware of, because basically it is any disease or condition that is made worse or caused by vaccination. So what are the symptoms? Well, the symptoms can vary greatly. I think, as I mentioned earlier, they can be something like itchy skin, diarrhea, respiratory signs, even seizures. Just as an example, typically the vaccinosis has something to do with some sort of very slight form of whatever the patient was vaccinated for. And I have an example here. So for instance, clinically, a patient with rabies can show fear, loss of appetite, seizures, and throat or nasal spasms, amongst many other possible symptoms. So a patient with rabies vaccinosis may show some fear behavior. They may just start to act fearful within a few days after the vaccination. They may have an unpredictable appetite. They may experience seizures, and they may have something that's been termed reverse sneezing, where it's like a spasm of the airways. It sounds kind of like snorting. I'm not going to imitate it because I'll sound ridiculous, but so the symptoms can vary greatly. How is it treated? The only reliable way to treat vaccinosis appears to be with homeopathy, because there are several different remedies that can be indicated for vaccinosis, the correct remedy must be carefully chosen by a veterinarian trained extensively in homeopathy. Many people believe erroneously that Thuja is the vaccinosis cure-all, but it's not. While Thuja is the preeminent vaccinosis remedy, there are at least 14 other different remedies that can potentially be indicated with vaccinosis. Can it be cured? Yes, when the correct remedy is chosen, it definitely can be cured, as long as any interfering substances or lifestyle habits are corrected. Then these would be things like if the patient is on some sort of drug that could possibly interfere. So what about vaccine detox? And some of you who've been to our clinic may have experienced this with your pets. There are certain homeopathic remedies that have been used as a standard detox after vaccination. Some of my colleagues, as well as my predecessor, utilized this practice. And after taking this homeopathy course and learning from Dr. Pitcairn himself, this is not really recommended because it really doesn't do anything. It doesn't prevent reactions, and it's treating in the absence of symptoms, which is not really what homeopathy is all about. Homeopathy relies on symptoms because the symptoms tell us how the body is reacting to these disruptions in balance. We no longer routinely detox at Natural Pet. What about joints and vaccines? So vaccination has been frequently associated with the development of antibodies to various different connective tissues, including collagen. And vaccination may also contribute to certain muscle diseases that we don't know the cause of. Things such as fibrotic myopathy. I don't have any direct evidence for that, but several studies have shown that in addition to antibodies against collagen, they have seen antibodies against muscle tissue as well. So collagen is found in abundance in the joints. Some makes up 70 to 90% of our muscles, tendons, ligaments, and other joint supporting tissues. And when collagen breaks down, the joint becomes less stable, muscles and connective tissue loosen, bones and the tissues become more brittle, easily breakable, and things such as arthritis, even degenerative disc disease, tendinitis, and overuse injuries can occur. Cranial cruciate ligament tears are becoming extremely common in dogs. We're even seeing them in smaller and smaller dogs. as are patella or kneecap problems and elbow dysplasia. Vaccination has potentially been implicated in cases of polyarthritis in dogs, and several studies in both humans and dogs have documented antibodies within joint tissue as a result of vaccination. I'm just going to mention a couple of studies. I don't want to get into too much detail. There was a study at Purdue University in 1999 that evaluated puppies that were given vaccinations and compared them to puppies that were not given vaccinations. And they measured how much antibodies they developed against their own collagen. So they found out that the puppies that were vaccinated did develop these antibodies. The puppies that were not vaccinated did not. Other studies have found antibodies to collagen in most patients with various different types of arthritis, including rheumatoid arthritis and just plain old, what was thought to be old age arthritis. There was a study in 1989 that found autoimmunity to collagen in at least 72% of dogs with rheumatoid arthritis, as well as dogs with cruciate ligament problems that showed increased levels of autoantibodies. And their conclusion, they studied lots of different types of joint problems, and they basically found anti-collagen complexes present in all of them. And in dogs with cruciate tears in one leg, studies have also shown that they do have elevated antibodies against their own collagen in the other leg, and this was a pretty accurate predictor of future tears. So when multiple joints were tested, higher levels of autoantibodies were found in the stifle or the knee in patients who eventually tore the other leg. These antibodies have also been found in other joints and dogs suffering from arthritis of other causes. I find it interesting that all these studies, all the authors' conclusions were the role of autoimmunity is unclear and that more investigation is needed. One wonders what the conclusion might have been if their studies weren't sponsored by one of the major vaccine manufacturers. Additionally, I just want to say that antibodies to kidney tissue have also been detected in vaccinated dogs and cats, and this may be an important factor in the development of kidney disease, particularly in cats. What is the true duration of immunity? There certainly is individual variation, so it's going to vary from patient to patient, but recent research has proven that immunity to diseases such as distemper, parvovirus, and canine hepatitis, it lasts at least 3 years after the first puppy series and then 1 year booster. And the same goes for feline distemper, herpes, and calicivirus. But we really don't know the full duration because no long-term challenge studies have been performed, but it is highly likely to be much greater than 3 years. So we're going to talk a little bit about this study that is at the University of Wisconsin-Madison with a preeminent immunologist, Dr. Ron Schultz. And their goal is to try to determine the true duration of immunity with the rabies vaccine up to 7 years. And they're using a test called an RFF, or Rapid Fluorescent Focus Inhibition Test, or RFFIT for short, which is the standard for rabies titers established and used by the CDC and the World Health Organization. So, for instance, if you wanted to take your pet abroad with you, if you're not Johnny Depp and sneaking your pet in, then you can actually have them, if you're going to a country where rabies has been eradicated, such as Great Britain, you can just have your pet titered. Your pet doesn't need a rabies vaccination, and depending on how long you stay there, your pet may never need a rabies vaccination again because it's eradicated, and they don't even require it. So, I also wanted to mention, going back to the Kansas State University study that I mentioned earlier, they looked at 74 dogs and 33 cats with current, some were current, but most had out-of-date rabies vaccines. Most were 1 to 2 years overdue. Some were 3 to 4 years overdue. And they studied that anamnestic antibody, the memory And they found that when an animal with an out-of-date vaccination received a booster around the same time that they were exposed, that the neutralizing antibodies in the blood rose and protected them against exposure. One of the researchers has said that basically once an animal has been vaccinated, they can receive a booster if they're exposed, and their chances of survival are very, very good. They also found during their studies that for some manufacturers, and they did not name names, the 1-year vaccination and the 3-year vaccination were completely identical. So while these vaccines are licensed for a certain number of years, the immune system doesn't sync to a date and just stop having immunity after 1 year or 3 years or what have you. So this slide, sorry for bouncing around, goes a little bit back to the University of Wisconsin study. They did go on to further test some of the dogs that had low or no detectable RFFIT antibody, so to determine whether they had immunologic memory. And this in vitro test showed whether they had memory cells present, even in cases where serum antibody can't be detected. So yes, I mentioned before we can't measure these memory cells, but in order to test them, you do have to expose the patient to the disease. But the results of this further testing indicated that most of the dogs vaccinated as long as 5 years ago, even without a positive RFFIT, they did have immunologic memory. So what does all this immunology gobbledygook mean? It means that most, if not all, patients vaccinated against rabies will be immune even without regular boosters. I'm not telling you to disobey laws. We have to abide by the laws whenever we can. But these recent studies do give further justification to providing exemption for certain patients when titer levels are shown to be adequate. So the American Animal Hospital Association does have some recommendations. They kind of separate them into core vaccines, ones that they feel should be recommended for all patients, dogs, cats. And so those include rabies as per state law. In Illinois, the first one is 1 year duration, and then each one after that can be 3-year duration. Now, some clinics will repeatedly give the one that's labeled for 1 year and just keep giving 1-year certificates. While that's not technically against the law, I think it's ethically not right, because you can just as easily give the 3-year, you can have the 3-year last for 1 year, but you can't do vice versa. But they do it to keep people coming back, but not something I do. They also, for core vaccines, they consider canine distemper, parvovirus, and adenovirus, which is also canine infectious hepatitis. All of these diseases can be very serious in dogs. Still for dogs, but these are considered non-core, so we have to evaluate whether or not the patient is at risk and then decide whether to give them. So one of these includes the kennel cough, which is usually a combination of parainfluenza, not the same as canine influenza, and Bordetella, a respiratory bacteria we mentioned earlier. It's usually an intranasal product. They actually have an oral one now, but these are much better than a shot directly into your bloodstream because it's a surface immunity. It protects where the organism's actually going to come in, and it's not going to cause a systemic problem. More non-core vaccines. Borrelia burgdorferi is the bacteria that causes Lyme disease. And lepto is another one. So these two can sometimes be a little tricky, but I'm just going to give you my professional opinion from my experience and from my knowledge. So here goes. With Lyme disease, since only a small percentage of dogs that become infected with Lyme disease actually become sick, I really tend not to recommend this vaccine. There's also controversy over whether or not to vaccinate dogs with an already positive level of antibody to prevent super infection, so getting infected again and then perhaps getting sick. But it's been my experience that vaccination of a dog with an already existing level of antibodies can result in autoimmunity. I have seen this occur. I have seen dogs develop something called Lyme nephritis, where antibodies are deposited in the kidneys. It is an irreversible, unstoppable condition that definitely has something to do with vaccination. And it can be life-threatening. As for leptospirosis, well, leptospirosis, there are several different strains. There are a couple different vaccines. Some of the newer ones have some of the more commonly seen strains, and the older ones have sort of faded away. It's bacteria that can affect the kidneys and liver, and it can be passed to humans, which is part of the reason why so many people say, oh, we should vaccinate against it. It's usually acquired through contact with wildlife, the urine of wildlife, puddles, standing water, perhaps wet grass if there's a lot of wildlife. But there are several studies documenting leptospirosis organisms in the urine of perfectly healthy dogs. So it's my opinion that this bacteria is only a problem when the patient's already stressed out through heavy work, exercise, poor diet, some other kind of stress. This particular vaccine also appears to be the one that I and others have seen a lot more of the real severe reactions to, particularly in small breed dogs. Vaccines that are not recommended at all by the American Animal Hospital Association include coronavirus. This tends to be a relatively mild intestinal virus, and vaccination has not been proven to reduce incidence. But I see some hospitals sneak this into their distemper combo, especially with puppies. The Giardia vaccine, they say it does not prevent infection, though it could decrease shedding of oocysts, which is like the eggs, if you will, of Giardia. And canine influenza. Influenza viruses are very dynamic. They change a lot. So this virus changes so quickly that vaccination is typically not very helpful. Talk a little bit more about titering. We did talk about what a titer is, but titering is measuring the level of antibodies in the bloodstream against a specific bacteria or virus. Titering is available for canine distemper, canine parvovirus, and canine adenovirus, also known as the hepatitis virus. It's also available for feline distemper, feline calicivirus, and feline herpes virus. Titering does cost a bit more than vaccination, but considering all the potential adverse health consequences stemming from over-vaccination, titering is a much better choice. And titering is typically recommended yearly, but in certain circumstances, we may wait 2 to 3 years. For instance, if we know the immunity lasts at least 3 years after vaccination, then we can perhaps wait about 3 years before titering and then recommend yearly thereafter. What if your pet's titer is low? Does that mean he or she needs to be boosted? Currently, as we said before, our tests can only detect the actual antibodies in the bloodstream. We really can't measure those memory cells without actually exposing the patient to the disease, and we certainly don't want to do that because we don't want to give them the disease. But this so-called anamnestic immunity means that new antibodies can be made in a big hurry by these white blood cells called B lymphocytes. Again, we haven't figured out how to measure these cells, but as long as your pet has a detectable level of antibody, they really may not need to be boosted, because that means that there's something happening in there. Their body's aware that this is out there and it's ready to fight, especially if they have low risk for the disease. They don't have a lot of outside contact. And thanks to anamnestic immunity, they likely are still protected. And can your pet be titered for rabies? Yes, they definitely can. We talked a little bit about that. It's that RFFIT test. They can be titered for rabies. We can potentially give them a letter of exemption if they have a disease that we feel is severe enough or can get severe enough through repeated vaccination. However, they will still be treated as if they were non-vaccinated should they bite someone, should they have contact with a rabid animal, and this means a 6-month confinement and mandatory revaccination. So I think that risk is pretty minimal. The bottom line is, except for rabies, which is required by law, you do not have to follow the majority who let their veterinarian just blindly vaccinate their pet without knowing whether the vaccine is necessary. In most states, including Illinois, a rabies vaccine does not need to be given every year. If your veterinarian's doing this, you need to ask him or her why. Because if they tell you because that's how our vaccine is labeled, I suggest you find another veterinarian, because they are doing you and your pet a disservice, and they may be even predisposing your pet to chronic illness. Questions? I'm really sorry about the technical difficulties. Well, while the questions are coming in, I'll just I have a little blurb about, because we've recently adjusted our protocols, our recommended protocols at Natural Pet, especially after taking the homeopathy course and learning about vaccinosis. We now recommend with young animals trying to wait till around 12 weeks for their first vaccination, although a lot of them that are adopted will have had a vaccine before that time, and then another vaccine at 16 weeks for dogs, usually for cats somewhere around 10 weeks and 14 weeks. This is for the distemper combination. And then with rabies, we're typically recommending at about 5 to 6 months when the immune system's a little more developed. And that's pretty much in line with what Dr. Jean Dodds recommends. I see a couple people typing. If for some reason you end up having a question and we didn't get to address it, okay, so Kim, we're gonna have to see about your dog and see what kind of issues he or she may have, and then we'll determine whether we can provide an exemption letter. I think we probably can if the titer's good. Let's see. So how about the importance of separating your vaccines from neuter spay? Well, Robin, you certainly can ask them, can you not give the vaccine the same day as the surgery? Maybe they can do it at the suture removal or something. Nancy, I'm sorry you're having trouble with audio. We're almost wrapped up here. If you missed something, please let us know. We can the link will be on YouTube, so hopefully the audio came through okay on YouTube. Dawn is saying her 2-year-old dog is due for the rabies in July. Got a new puppy. Okay. You know, if this would be your dog's first 3-year, you might not want to wait too much longer. It depends. If this probably would be your dog's first 3-year, because I probably wouldn't wait, Dawn, more than maybe another month. Especially, you just don't want something to happen. And if he doesn't have any chronic disease, he probably will be okay. Oh, I am so sorry about the technical difficulties. I don't know what it is. Okay, I'm getting another one. The friend's dog has kennel cough, is 10 years old. If the dog has not recently been exposed, it could be something other than kennel cough, Marie. So, as I mentioned, though, those intranasal and the oral vaccines are pretty low on the danger scale, because they're really just creating local immunity. So if he has kennel cough, he probably shouldn't receive the vaccine right now, but if he wants to be protected in the future, it's probably okay for him to receive it. All right, well, I think the questions have stopped rolling in. If we didn't address your question, or if you think of a question later, you can always email us. Oops, one more. Nope. I see people typing and then stopping. That's okay. If you think of it, you can email us info@naturalpetfamily.com. You can also message us through Facebook. So thank you, everyone, for attending. Again, I'm sorry about the technical difficulties. I will see about investigating that so it doesn't happen again. And join us next month on the last Tuesday, which I believe we are going to be talking about nutrition and diet. So have a good night.